Are you suffering with sciatica pain? You're wondering what is it, what's causing it, and what you can do about it? That's what we're going to discuss today. People commonly come into my clinic who are having pain down the back of their leg. They know it's sciatica pain, but they don't know what to do about it. And often many people have watched a lot of videos at this point, and they've tried a lot of different techniques. So today we're going to explain what it is, what you can do about it in the initial stages, which is different than what you can do about it in the later stages. So if you've had sciatica pain that's been going on longer than a month, let's say, this video is not actually for you. You've probably already figured out the basics of what the sciatic nerve is and what caused your pain in the first place and what you need to do about it. But what you need to do is very different than what people need to do who are having pain that just started very, very recently. So I'm going to encourage you to go watch one of the other videos on our playlist that talks about different things that you can do for sciatica that are more geared towards people who have pain for more than a month. Now, if you believe that you have sciatica pain that just started recently, you're in the right place. We're going to start by helping you to determine if what you're suffering from is sciatica. All right, so first off, let's start at the very basics. What is the sciatic nerve? So the sciatic nerve is the biggest nerve in our body, and it runs down the back of our thigh at the side of our knee. On the outside of our knee, it splits into two different branches, one that goes down the back of the calf, one that goes down the side of the calf. Now, it starts in the low back or in the lumbar spine. It starts from the nerve roots of L4 to S2. So what happens is all these nerve roots come out in between the vertebrae. So they come out right next to the disc, and then they come out a little ways and they join together to form the sciatic nerve. Now, not the entire nerve root comes together to join the sciatic nerve. So there can be other things that are causing pain that can kind of mimic the area of pain of sciatica. However, if it's the sciatic nerve, it's going to be pain that is going down the back of the leg to the knee often. And at the knee, it may be going down the back of the calf, or it may be going down the side of the calf. And that is a little confusing to people because they think, I don't have pain down the side of my thigh, but I do have pain down the side of my leg. Yes, that is actually probably still sciatica because that nerve does split when it gets to the outside of the knee. Now, I've also had patients come in who say, well, I have pain down the front of my thigh and it is sciatica. That probably is a nerve problem. However, it's not sciatica because sciatica runs down the back of the leg and then it splits at the outside of the knee, goes down the back of the calf and the side of the calf. So if that's where your pain pattern is, then yes, it probably is sciatica. But if it's anywhere else, chances are it's another nerve that's irritated. And this differentiation is really important because people believe that the pain is sciatica, so they watch all these videos on what to do about sciatica, and those things that they're supposed to be doing are probably actually exactly the wrong things. If the pain is down the front of the thigh and you're doing things for sciatica, you're actually probably causing further injury. So it's really important to understand where your pain is presenting at in order to find the right tips for you. Now, another thing I do want to mention is that a lot of people say, but I don't have any low back pain. And this is very, very common. So if you don't have low back pain, then chances are good that your sciatic nerve is getting pressure on it as it goes through the muscles in the hip. If your sciatic pain is coming from a disc problem in your low back, chances are good that then you do have some form of low back pain. However, the important point here is that you can have a pain-free low back and still have pressure on that sciatic nerve. Okay, so the sciatic nerve starts in the back, but then it goes through those deep hip muscles and it can get pinched or squeezed or tightened as it's going through there. It's important to understand that low back pain is not necessarily associated with sciatica. However, it can be. So if you have low back pain or if you don't, you can still be suffering with sciatica. Okay, so what are the signs of sciatica? These are important to know so you can see if this is what you're struggling with. So the primary sign of sciatica is pain down the back of the leg and often traveling to the knee. If the pain radiates below the knee, it may go down into the calf or it may go down the side of the leg. And this gets confusing for people because they feel that switching directions and they're like, well, I don't know if that's actually it. The sciatic nerve actually does split off and make two branches in the calf, so it can actually change your pain pattern. If you're suffering with sciatica, you have a positive straight leg raise test. So what that is, if you've been to the doctor or physical therapist, you've probably had this test done. And what you do is you lay on your back and they passively, so they lift your leg up and they're trying to get it to 90 degrees or your flexibility. What they're looking for though is not just tension in the hamstrings, because chances are good that you have tension in your hamstrings even if you don't have sciatica. They're actually looking for reproduction of numbness and tingling, or reproduction of your pain pattern. Now, you can do this at home. It's not necessarily as effective if you have to do it actively, in that if you have to lift that foot all the way up. But what you can do is use like a beach towel or a belt and hook it around your foot and then passively lift it up. And what you're looking for is to see if you have reproductions of that numbness and tingling or pain pattern that you would call your pain. That's probably sciatica. Another really clear sign of sciatica is if you have decreased strength with a heel raise. So we call that motion plantar flexion. So if you're standing at a countertop or next to your couch or something like that, where you have something for balance, and you try to lift your heel off the ground, and you want to do this with just the one foot that's causing pain. If you have bilateral sciatica symptoms and that you have it on both sides, then I want you to do each foot individually. But what you're going to do is try to lift your heel off the ground. Now, normal strength would be considered that you could do that 20 times. Not necessarily everybody has normal strength, but you should be able to do about 10 to 15. You may get fatigued, but it doesn't actually cause pain. If you're unable to lift your heel off the ground, either due to pain or weakness, chances are good it's your sciatic nerve. Now, the clearest indication to me that it's sciatica is when people walk into my clinic, they have a lateral shift. So usually they will shift either towards the side of pain or away from the side of pain. And there's a lot that tells me there, but there is actually this lateral shift that happens when they're walking. And I can often see it when they're standing too, but definitely when they're walking. So they'll walk through the door, they'll have this lateral shift. The other thing they usually have is a limp, because it's very difficult to walk with that sciatic pain. And so they limp when they're walking. So they're laterally shifted and they're limping when they're walking. They're complaining about pain down the back of the leg. I'm going to do a proper evaluation to make sure I know what I'm talking about, which will include a straight leg raise, but 99% of the time, that's going to be sciatica. Now, it's still important if you go to see a specialist to understand what is causing your sciatica symptoms. Because again, it could be coming from the hip, it could be coming from the low back. And if you don't treat the area where the pain is actually starting, then it's not going to get any better. So it is still important to do a full evaluation so you understand more about where your pain is coming from, as well as that determines your treatment plan, as well as that determines the long-term strategy for you for your maintenance program. However, I'm just saying, when people walk in with a lateral shift and a limp, I'm pretty sure it's sciatica, even though I want to prove it. So there's creating the hypothesis, and then there's proving it, which it should always be proven. Even when it's 99% certain that it's sciatica, there's that 1 in 100 times when it's actually something different, but it's acting like sciatica. So I would say if you've been seeing a specialist for a while and you're not seeing any resolution or any change in your symptoms, even for a short period of time, it could be that they're treating the wrong issue right now. All right. When does sciatica pain get concerning, as in I need to go to urgent care, I need to go to the emergency room, this is really, really bad? This is really challenging because sciatica pain is so intense, especially if it came on suddenly. It is so intense that people get really concerned and think, I need to go to urgent care, I need to go to the ER. Now, I will tell you, if your gut is saying, I need to seek medical attention, I always say, listen to that, because the truth of the matter is, like, you got to listen to your gut. That's all there is to it. I will tell you though, most of the time in cases of sciatica, even though the pain is sudden and it's sharp and it just comes on and it takes your breath away and you feel like you can't breathe and you're going to cry and you don't know what to do, often you actually don't need to go to urgent care or the ER. Okay, but I'm telling you, if your gut says go, then go, because maybe it is something that's acting like sciatica, but it is something big, bad, and hairy. Now, there are 3 things in particular that I do want you to look out for that definitely say do not pass go. You need to get into urgent care or the emergency room right away. The first one is if you lose control of your bowel and bladder. So now this is not just like I coughed and a little bit came out, like, okay, that happens. That's a pelvic floor dysfunction. That's another video. I am talking about I cannot keep control of anything. If that happens to you, I need you to get yourself to a medical professional as quickly as possible, or as quickly as you can have somebody take you, because you probably shouldn't be driving a car at that point. Another really concerning situation is if you have urinary retention. I have had some people with sciatica symptoms who are not able to urinate. They can feel the fullness in their bladder, but they are not able to release it. Now, this could also be a sign of a pelvic floor dysfunction. So it's not necessarily associated with sciatica, but it is a very concerning thing. If you find that you are not able to urinate, even though like you get so much pain that you're like, I really need to go, you do need to seek help from a medical professional to help you alleviate that immediate situation, as well as finding a specialist to work with to deal with it in the long term. And the last thing that I want you to watch out for with sciatica is leg weakness. Now, when I'm talking about leg weakness, I'm not talking about, oh, my leg feels unstable because it's painful. I mean, that is a problem, but that's not a I need to go to the emergency room problem. What I'm talking about here is I cannot stand up on my legs because they just feel like jello. In that case, I need you to get into a medical professional as quickly as possible, because that situation has become extremely concerning and could lead to long-term damage. Now, why does the sciatic nerve get irritated in the first place? Well, we kind of alluded to this earlier, but there can be multiple reasons. So again, there's 4 different nerve roots that are contributing to the sciatic nerve. So any of them could be irritated by the facet joint, which is the joint that is in between the vertebrae, located very near the nerve root. It could be irritated by the disc. You may have a herniation or a rupture that's irritating that nerve root, which is leading into the sciatic nerve. You could have increased muscle tension in the hips or the low back that's putting pressure on that sciatic nerve and causing problems. You can also have increased fascial tension in the abdominal cavity that is putting a lot of stress on that sciatic nerve. I am seeing more and more of that recently, and actually having patients come in who don't have good organ mobility, and this is actually causing increased stress on their sciatic nerve, because the sciatic nerve is associated with the abdominal cavity too. So sciatic nerve problems can actually be related to organ mobility issues. Now again, this is super complicated to be able to explain, as well as to be able to figure out on your own, which is why you need a specialist to help you understand the unique things that cause your sciatic nerve pain. All right, now I promised you at the beginning I was going to discuss what you can do if you just started having sciatic nerve root issues. All right, here's the top things that I want you to do. And now this is within the first 24 to 72 hours. These policies and procedures change after about 72 hours. But initially, when everything is red hot, flared up, and all you want to do is curl up in the corner and cry, well, kind of going to let you curl up in the corner and cry. I just want you to do it with an ice pack. I want you to get some ice on that back for 5 minutes every hour. We want to start decreasing the inflammation as much as possible. Now, if more of your pain feels like it's in your buttocks and going down the back of your leg, then put the ice pack there. If you want, do a traveling ice pack. Go low back, 5 minutes, buttocks, 5 minutes, hamstrings, 5 minutes, then back to the low back at the top of each hour. You want to keep the inflammation as managed as possible, and ice is the best way to do it without having to take medication. The next thing I'm going to have you do is I'm actually going to have you rest. In general, movement is life, and every tissue is designed to heal itself as long as it's moving correctly. But see, that's the problem when we're talking about sciatica. things are not moving correctly. Everything's inflamed, everything's angry. If you try to move in general, you're causing more damage along the way in that first 24 to 72 hours. Now, if you can find motions that you can do pain-free and that actually make you feel better, then fantastic. Do as much of that as you can, but make sure you're not aggravating your symptoms and you don't feel worse when you sit down to ice. And the last thing I want you to do is make sure that you're working on your breathing. When you are doing your deep diaphragmatic breathing, it not only activates the vagus nerve, which is your feel-good nerve and will help to calm your body down, but it makes sure that all those organs in your abdominal cavity are moving correctly. And when all of those are moving correctly, it can take some stress off of that sciatic nerve. All right, so there it is. All that you need to know about sciatica, including what it is, what causes it, and what you can do in the first 24 to 72 hours. Now, if you have had it for longer than 72 hours and you're looking for some stretches and exercises and things you can do, I'm going to encourage you to go check out our playlist over here that has a bunch of videos on it on things that you can do right now.